Good morning or good afternoon to everyone. I hope you can hear me, and I also hope that you can see my screen. Amy, can you see it? I don't know.
Yes, yes, I can see it. And if anyone cannot see it, let us know.
Yeah.
Raise the red flag.
Okay. Yeah. So my name is Ida Salminen, and as Amy said, I work with the UNFPA, the UN Population Fund, Procurement Services in Copenhagen in Denmark. And Karina and I will be talking about the AccessRH Procurement and Information Service today. So our agenda is to first what is AccessRH, and then introduce you to the products and the quality assurance processes on a very high level, and also to talk about our information database called the Reproductive Health Interchange that we have on our website. And we'll also briefly go through the order process, and at the end we will take questions. So what is AccessRH? It's UNFPA's Procurement and Information Service for reproductive and sexual health supplies, non-UNFPA clients. So we work with NGOs as well as low and middle income governments, and we aim to provide them with access to high quality, affordable commodities and also information about global RH supply procurement. And we are not just UNFPA, we're located physically within UNFPA, but we have funding from USAID and from Bill and Melinda Gates Foundation, from the European Community, and from the Federal Ministry for Development of Germany. And we're also supported by the Reproductive Health Supplies Coalition. And in fact, that is the coalition is where the idea for AccessRH came from initially. Now,
Ida, let me just check because I know someone said they can't see the screen, that it's loading in the document. So I hope that is just one person. I don't like that one person can't see it, but if anyone else, please let us know if you cannot see it. If it's more than one person.
Can you see the entire screen or the PowerPoint, or can you see?
I can see everything. One person is having. I just got a message from someone else that they can see it, so I'm hoping it's just that one person that's having problems seeing it. I just wanted to make sure. All right. Thanks. Sorry about that.
No, I hope you can see and hear me. So why does AccessRH exist, and why is something like this needed? It's really because over 200 million women still lack access to contraceptives. Even if they would want to use them and have access to them, they don't. And there's a number of reasons why it is so. And there's social, cultural, economic, a lot of reasons why. But part of that is due to procurement challenges related to actually getting the supplies to the end users when they. And those procurement challenges are, for example, unpredictable funding, lack of information about the products, or just supply chain management, long lead times, product quality issues, and I'm pretty sure that most of you recognize these issues. And these are the issues that AccessRH works with. So we're trying to get rid of these issues such as lack of information and long lead times and the quality issues. And this is the AccessRH mission. We really aim to improve access to reproductive health commodities, and the way we are trying to achieve that is by enhancing delivery performance, and that means trying to get things faster. And also we strive to improve information related to the supply chain. This is mainly through sharing information on our website. And the AccessRH clients, as I mentioned briefly, are ministries of health in low and middle income countries and non-governmental organizations. And we also work with other UN organizations as well as UNFPA country offices. So often the ministries of health or NGOs located around the world, they work with local UNFPA representatives and then hear about our service through them. Now, Karina, are you there? And can I hand over to you? Sorry, we're not physically in the... So if it's possible, Amy, can you unmute Karina and let her speak?
Oh, right. Sorry about that. Okay, Karina?
Now I think you can hear me.
Sorry, I'm trying to get new people on, the people that are having problems hearing and things like that.
Okay. Can you hear me okay?
Yes.
Okay, great. Good. I'm sorry I had to run here late from another meeting, but I'm glad to be with everybody today. And I can see that Ida was giving the introduction for AccessRH. And Ida, I don't know if you want to continue or do you want me to take over, or what do you want to do?
I thought if you could maybe continue from here, and then
sure,
I can go through the order processing.
Yeah, that would be great. So we, as Ida might have told you, we at UNFPA we've been doing procurement for many years, for well over 30 years, but that was usually for our own country offices and for the programs that we served in different countries. But over the years we started to learn that there's another need out there, and that's the need of individual organizations and also governments who are doing their own procurement. And so we started to try to work with those different groups and find out what were their challenges and in what way could UNFPA be helpful to them. And that's really AccessRH. And we looked at a lot of different areas where we could be helpful, and the areas where we really defined where we could be of service, where there's a lot of challenge, but where we don't necessarily play a big role. But in this particular area of better planning and providing very safe and effective products and making ordering easier for people, because, of course, procurement of many different items can be very challenging. So these were all areas that we decided that we could try to be a partner with organizations and ministries of health on. So let's see. Just seeing if I can move this forward. So in terms of better planning, the things that we've found have been helpful is to make sure that product information is available and out there to people. So we've put our entire catalog online, which is on our our website, which we'll show you in just a little bit. And there you can find out all the product specs. And we've also made all of our pricing transparent. We think that's really important, even for those people who don't end up procuring through us, because then they can get a sense of the prices that we're able to get from suppliers. Of course, we're one of the biggest buyers of contraceptives, for example, and reproductive health supplies in the world, so we can get very good terms. But if a government is going to do procurement on their own, we think it might be helpful for them to see what prices we get and maybe use that as a means to negotiate with different suppliers. So we put all of our prices online. And then we also provide both historical and current shipment information, especially on contraceptives. We put that all online so someone can track their individual order, but they can also look at a particular country and say Mexico. Last year, what was procured in terms of contraception in Mexico? Who was paying for it? Where did it go? What kinds of products are being used? Or to do a comparison across different countries. So we think all this type of information can be helpful to someone who's either working on their own organization's procurement or else working on advocacy, for instance, in reproductive health care. We also think it's very important, of course, to provide safe and effective products, and we do a lot of work to make sure that all of the products that we do provide through various vendors have gone through a rigorous testing and quality assurance. And we'll talk a little bit about that in more detail in just a second. But we also, as I said, have very competitive prices, and we sort of try to do all that work of working on the bids before our clients, our organizations and governments that we work with come to the table. So we do a transparent bidding process, and as part of that, we not only make sure that we have good prices, but we make sure that the products that we're using are safe and effective. And then, of course, we also hold some key items in stock, such as condoms, because condoms, for instance, have a very long lead time. And by holding them in stock, we can make sure that we can get them to the people who order them within, for example, 2 weeks time, which is a big improvement over the typical lead times. So that's something we've also tried to do, and we continue to add new items to stock all the time, and mostly focusing in the area of contraceptives right now, because that's an area where a lot of times organizations and countries face stockouts. And then we've tried to make the process of ordering easier. Whether you're a small organization and trying to order several different items from different vendors, or a huge government who is buying many different types of things, both contraceptives and pharmaceuticals, medical supplies, medical equipment, it's a huge task to do a procurement activity for each one of those to engage in the bidding process, and so we try to put all of that. We try to take care of all of that. Come to us, they can just order all the things they need, and it can be from multiple manufacturers, and we take care of the whole order. We arrange the whole order and all the shipping. So we hope that is a way to make things much easier for people. We have tried also within our own organization to really simplify our financial processes and ordering processes to make it as easy as possible. And then we also provide the ability to follow your order, and we also send out regular updates for people, because we know everyone is busy and that procurement isn't the only thing that most people are doing. They're usually doing a million other things. So we try to get the information to you rather than you having to go and search for it. So this is just a little peek at our website, which is called myaccessrh.org. And there we really try to put all the information that you might need in one place. So we have a lot of information services. We'll go into some of those in a little bit. But there you can find information about our quality assurance policies. You can find a list of the suppliers that we have quality assured, the ones that we work with, so that if you want to go directly to the suppliers that we use, you can do that. There's their contact information. We also have the RHI interchange. We'll show you that in just a bit, but that's where you can find all the information about global contraceptive shipments in the world. Very helpful if you're doing any kind of comparisons or planning, advocacy work. On the other side, the area where you see it says Access Supplies is our Procurement Services. So that's UNFPA's procurement service. And there you'll find out about the steps to order. You can take a look at our catalog. And you can also find out about the typical lead times for different products. You can also order from us customized artwork for your products. So for example, if you want to put special labels on condom packages, you can order that, and you can find out how to do that on our website. Just a brief overview of the catalog. Right now we have over 36 contraceptives and 20 different types of reproductive health kits. These can be anything from fistula kits to birthing kits. Some of these are very helpful if you're in a situation such as a refugee camp or emergency situation. So we work with technical specialists within UNFPA and all of our partner organizations to develop different types of kits that we think are useful in the field. We also have just close to 500 medical equipment items. These can range from everything from wheelchairs to surgery tables, surgical equipment, all types of things. And then 285 and growing pharmaceutical products related to reproductive health care. We'll give you a little peek at the catalog a little bit later on, but I definitely encourage you to go online, and it's a large document, and has many things, so many more than the typical items you might think of normally from UNFPA. So talking about the products, as I mentioned, we do a lot of work to make sure that the products that we provide to our partners are very safe and effective, and that we get a good price. We always want to make sure we get a good value, but that the product is very safe. So we don't just take the cheapest items, but we work with the vendors to get as good of a value as we can. So we do some different things to assure this safety and effectiveness on products. And the first thing is a pre-qualification. This happens during the bidding process. We make sure that that vendors can produce the types of information we want to see regarding their production, the materials they use, just the process that they go through when they're developing different products. We do technical evaluations, and those are ongoing. We regularly inspect the vendor sites that we use, so they not just the first time that we approve them, but then we continue to do regular checkups. And that also takes place with the quality control and monitoring. We work very closely with the World Health Organization, and we've developed ISO standards also within our organization to make sure that we have a rigorous process for quality assurance. Here you can see more specifics about the types of products and which quality assurance processes they go through. Pre-qualification for several different contraceptives is done, and this is to make sure that, as I said, both the supplier site and the way that they produce the contraceptives is effective and safe, and then that the final product works, that the condoms are not going to break, that they've been tested numerous times, and we do also testing of condoms, for example, of batches before they're shipped out. We do technical evaluations of several different types of kits and medical devices. And then we work with country governments to do capacity building. We work with a lot of laboratories who do condom testing and make sure that their quality control is in line with what we're doing, or we offer advice if they ask for it. And we work with national regulatory authorities to assess, which items that they think are ones that are high in demand. We will then conduct evaluations of those so we can make sure that we have them in stock for countries that are asking for those types of products. So you can read more about our quality policy online at the address that's at the bottom of the screen there. We also develop, in conjunction with several other organizations, guidelines for procurement and pre-qualification of different devices. And these are just informational for those governments who are doing their own procurement. And we found these to be really helpful guidelines. As I mentioned before, we have online a list of the suppliers that we have already pre-qualified. We have their names, their country and address, and also contact information and when they've most recently been pre-qualified, so that if you're interested, you can always go on and see the list of those. And the pre-qualified suppliers include male and female condoms and IUDs on that list. I'm going to tell you a little bit now about the RH interchange, which is our information part of AccessRH, and we'll show you a little bit about how we use it. This is a snapshot from the actual web page, and as I mentioned before, you can go here if you want to find out about contraceptive orders and shipments, either your own that you've placed or else all of those from a particular country that you're interested in. We cover more than 140 countries in this data, and it's both goes back to about 2000 and then is up to date as of today, and it covers over $1.9 billion worth of goods. It's about 85% of the global procurement, public procurement of contraceptives that's included there. So the kind of information that you're going to get when you go on there is order shipment data. It's going to tell you about who was the manufacturer, what is the product, what country is it going to, the shipment date and receipt dates. It'll tell you the quantity of items that were purchased and of course the cost as well. And so you can check all of these things for various countries and also do comparisons side by side. So the RHI interchange takes all that information and creates all kinds of data that you can either download into Excel, or you can create reports and graphs and maps. Our own country offices within UNFPA use this quite a lot to do analysis of each country's contraceptive procurement. So you can look at a summary of shipments for a given country, or the history, or a geographic summary, and we'll show you what some of these reports look like. But first, just to tell you that the data that's provided here is not just UNFPA data, it's from several large procurement agencies. So it includes International Planned Parenthood Federation, Crown Agents, which is a private procurement agent that the British government works quite a bit with. And then we have individual governments such as the Ministry of Health in Nepal. We have DKT organization within Ethiopia, and then the U.S. government, Marie Stopes International. We have several different organizations, so that's why we cover a very large range of contraceptive procurement. And this slide just tells you a little bit about how the different types of reports can help you. So when you go online, you can play around with it a little bit and see the different types of information that you can pull up. And then to show you a visual of how this information is used, we pulled information for Uganda. We saw several callers were coming from Uganda. So here you can see what was the value of contraceptives that were sent. And this is as of today, today I believe. And you can see sort of over the years from 2009 onwards. So you can see the types of contraceptives that have been used. And you can see that they change. The use of them changes over time. So this can be really interesting when you're trying to look at trends for individual countries. Here we're looking at who is funding contraceptives in Uganda. And you can see that USAID, I think that's USAID, it's small on my screen, but is one of the biggest funders.
USAID, and then UNFPA is the purple one.
Yeah, and UNFPA is the purple one. So you can see that those two are the predominant funders of contraceptives over the last couple of years. And we're going to talk a little bit about the ordering process for UNFPA. And I mentioned before that we go through the process of establishing long-term agreements with all of our suppliers. So we go through a very transparent bidding process, and then once we've selected a vendor, then we create a long-term agreement with them so that we can pull from that agreement anytime an order comes through. So that means when you place an order with us, we don't have to go through the bidding process there. We're all ready to place the order. So that really helps in terms of speeding the purchasing process and allows us to pool the volume that we buy. So we can get a lot better prices through that process. And I think, Ida, did you want to take it from here?
I can do that. Sure.
Okay.
To this, actually. So to show you on a high level how the order process actually works, if you or your organization decide to procure through UNFPA. First you would choose the products and the items that you want to order from the AccessRH product catalog, which is available on our website. And on the website, we also have a request form that you would then fill out and send to us. And then our buyer would work with you to figure out the details, if there was anything special about the order. For example, if you wanted to customize the artwork or the printing for the product. And then our buyers will send you a pro forma invoice and an order confirmation form once they've talked to see how they could fulfill the order. And then the client would need to sign a confirmation form and also then after the funds have been received by UNFPA, then you would place the order with the client. And once the products have been produced, and then they're shipped by air or sea, they arrive at the port, and the customs clearance is the responsibility. So that was the process in a very brief. Here's I'll go through the steps on a bit more detail, so you can see what it would actually what the different documents would look like and what the steps would entail.
Hi Ray, I'm just wondering if you're on the call. Looks like you're not. I'm just trying to figure out what's going on.
Okay. I can kind of hear myself, but I'll continue anyway. Yeah, so this is the AccessRH product catalog. It's currently in PDF form. We're working to create an online tool, so you would be able to find the product in a bit more user-friendly way. So that will be coming up in the next few months. And the next step after you've searched the catalog, then you choose the product and you out all the information. And yeah, this is if you're interested in customized artwork, this is actually an example of what someone in Africa ordered. This was printed on the condom foil. Yeah, and the VIP Plus is it's a picture of a photo of a box that then included three condoms, and so there's a lot that can be done, and this adds, of course, to the cost and the lead time, the production time of the products, but a lot of clients prefer to do it that way. So once you've filled out everything, the buyer would send you a invoice, and when you decide that it's exactly what you had asked for, then return the signed confirmation form and transfer the funds. Now, UNFPA requires advance payments from external clients. And just recently, we've worked with a letter of credit, which is something that in the future we'll probably be using more. So that was a way for the client to avoid the advance payment. Yeah, once the funds are transferred, then the order is placed with a supplier, and then it's shipped. And once it arrives at the port, then the customs clearance is the client's responsibility, as I mentioned. Now, this slide is something important to consider in the planning process. So, all this, even though it's not many steps, it might and will take some time to get to the end users, as I'm sure you all know. It's just something that is good to be aware of, and means that if you need the product in 2 weeks' time, it might be a bit challenging. But part of what AccessRH has been doing in holding certain standard products is to decrease this lead time. Did you have something else to add? I don't know if you're actually muted right now. Yeah.
Okay, now I'm back on. So no, I would definitely encourage you to go to the website and have a look around, take a look at the catalog, and of course be in touch with us if you have any questions. You're welcome to email me. My email is at the top there of the contact information. If you have specific questions about an order for a specific region, you can get in touch with the people that we have listed there, and we'll send a follow-up email later on that also has this contact information for you. But I noticed that a question just came in, and it says, it was asking about procurement in the case of Global Fund.
Karina?
Hello? Okay.
Ida, did you, maybe I could send this question to you since we can't hear Karina. Something happened with her audio.
Yeah.
I'm just sending you the question that we got from Dr. Barakushia.
So
do you see the question? How does procurement work in the case of Global Fund grantee procurement?
It might be good to wait for Karina to get back on.
Okay.
I don't know.
What do I can unmute people, so if people have questions, you could write it in the box, or I can just, let me see if I can unmute everyone and see how that goes. Sometimes it creates too much feedback, but I'm going to try unmuting everyone. Okay, it's a little bit louder now. Is that Karina?
Yeah.
Yes,
okay.
I can hear you now.
We can hear you.
Okay, good. I was talking away before I realized that no one could hear me.
Okay.
I was just going to say that regarding Global Fund procurement, we work very closely with several organizations that receive Global Fund grant money, and we often conduct procurement for them. So that's something that we're very familiar with, and it depends a little bit on the organization how it's organized. Sometimes the money from Global Fund will come directly to the organization, and then they'll use that money to place an order with us. At other times, Global Fund will provide us directly with the money. So I don't know if you have a specific question regarding that, but it's definitely something that we are familiar with and do quite often for different organizations, including even the UNDP.
Elvira, was that a good response? Was that helpful?
Yes, that's good. I think it's very important to also to help the grantees figure out how to do their procurement, and to find qualified suppliers is always a challenge. And so having somebody that has already been pre-approved does help. Thank you very much. Great presentation. Sure. Great work. Look forward to hearing more about you.
Great, thank you.
I just posted the next question to everyone. I just shared it with, so you should be able to see it now. How do NGOs find out about this system? Are NGOs vetted at all, or is it open to all NGOs? That's a good question.
So it's a very good question. So generally, as long as it is a nonprofit organization working in the area of maternal health or sexual health, any area that would be related, even we work with youth organizations. All different types of organizations, also social marketing organizations. So we're very pleased to work with any partners in the field. And if organizations are interested, they can just get in touch with us. And as I mentioned, my email address is the contact information. And one thing that we're really trying to do, the UN is a large system, and UNFPA is a large organization, and these organizations can, as you know, sometimes be a bit bureaucratic. But one thing we're really trying to do within the AccessRH program is to be responsive and flexible, to really learn what are the needs of our partners in the field and try to figure out how we can be helpful. So we have general rules about how we function, but we really want to hear from each person, each organization, what is their need, and then we really try to work and see if we can come up with an answer that's helpful to them. So as Ida mentioned, in some cases governments are not able to pay in advance, so we're now trying to issue letters of credit. And in other cases, they're a small order, so we try to work with organizations to maybe pool their orders together. So really, if there's an organization out there with interest, we'd love to hear from them, and we'll do whatever we can to try to help them. We know it can be really tough to get access to different kinds of supplies related to reproductive health care, and we think that we have a role to play in either creating that branch between an NGO and the larger vendor. If we can play some sort of advocate role in that way, even if we're not the ones doing the procurement, then we'd be really happy. So. We've been providing a lot of advice to governments lately on how to do their own procurement. That's also, a great thing when a government can do their own procurement. I think that's sort of the end goal in many cases, but it takes a lot of resources to get there. So if we can provide some of the technical expertise, we're also really happy to do that.
Great, thank you, Karina. I think it's really exciting that you've offered to help us out with this, and for our members and other organizations that want to learn more. And I know there's one person, actually it's the Ugandans. I don't know that they were all able to call in, and there's one in particular that I know has been having some issues, but he wasn't able to call in, so it'll be great to get him linked up with you. And now you had some questions maybe you thought about asking. Did you want to open up to ask any questions of the audience? Hopefully people will be willing to participate.
That would be great
if you have.
Yeah, a lot of what we're trying to do is to learn from different organizations, what are the challenges that they're facing in trying to get the supplies they need, and what are the needs that they have. And so if anyone out there could talk a little bit about what types of supplies that they're regularly using, how do they go about getting them? Are they facing any challenges? Really interested to hear about it.
Anyone have any specific examples or things you've heard of?
This is Elvira, and I just have a short comment. I think one of the important problems is the quantification of needs, and to make a good estimate, having the capacity to really estimate how much you're going to need so you can plan your procurement appropriately. And then at the same time, that depends on the capacity of the facilities to keep good inventory of their supplies and their consumption. So I was wondering if you also provide any assistance in those two areas.
Well, in the sense of planning, we try to work. We work in a couple of different ways. One is with that RH interchange that I showed, so that countries or organizations can go in and see sort of what the pattern is overall in the country and with the government or different organizations. We hope in that way that might help a little bit in terms of planning and having a sense of the quantification. We also participate in the CARS group, which is you may be familiar with it, but it's a group of organizations that work together to try to gain a sense on the ground, using their country offices and other sources, of how things are looking for contraceptives, and getting a sense if it looks like there's going to be a stock out at any time soon. Then we try to work together as a team with different members, such as USAID, to see if we can help to mitigate that stock out, to get the supplies where they need to be. And we've had, relative success with that. So in some cases, on the ground, there's coordinating committees with all the different stakeholders involved, and they are sometimes extremely well functioning, so that they can have a better sense of what all the different groups are bringing in. But of course, it's a lot of work to keep on top of it. So
sure,
something we're always trying to improve.
Great, thank you. That's very helpful.
There's another question. Thank you. I'm sorry. There's another question that came up. I just posted from Katie. Katie, if you can speak, I know you said you were calling from overseas. I'm curious where you're calling from. Are you on the audio?
I'm calling. Yeah, I'm here.
Okay.
I'm calling from Nigeria.
Oh, great. Okay. Wow. Well, he asked, is there any way to ensure that people actually have access to these contraceptive devices? Besides procurement by government and NGOs, how does AccessRH monitor distribution to those who need them?
Yeah, this is, of course, a really important piece, and one that we unfortunately mention, because we try to work with vendors, the suppliers, and with governments and NGOs to get the products into the country. So about the farthest we take the product is to the warehouse. And we do work through our country offices to really, try to engage the government and NGOs and partner with them, but we don't work on the distribution. And I know that piece can be a big challenge, of course. We've actually sometimes seen our own products for sale in markets, for example. So we know that something's going wrong along the distribution chain. But it's a big challenge, and one, unfortunately, that we don't at this time work too much with. We don't have the resources to follow the product all the way to its individual user. But we're very interested, if you have any stories about how that's working in Nigeria.
Thank you for that question, Katie. Oh,
yeah.
Go ahead. I heard someone speaking. Is that Katie?
Yeah, it's Katie.
Katie.
Okay, why I asked this question, from my practice and experience in Nigeria, I discovered that many people do not like contraceptives. I'm actually a resident in OBGYN in a hospital in Nigeria, and many of our patients do not like to use the contraceptive, especially the hormonal contraceptives. They may use the barrier methods if they want to, but most of the time they do not. They have many bad experiences about it. They tell you people who use contraceptives end up not having children in the future when they want to have them. So even when we have campaigns about family planning and importance of contraceptives, most of the people do not use them. They don't even go to collect them. So I don't know how we can sensitize the people or encourage them to use contraceptives when they need to.
Yeah, it's a problem not just in Nigeria, because when we've been out meeting with different countries, governments, ministries of health, there's a lot of talk about myths. There's a lot of myths about different kinds of contraceptives, and some that they say that it will destroy your reproductive organs, or there's different kinds of things. And we've talked a little bit. There have been some requests for us that maybe on the website we could talk about these myths. And I think it's an interesting idea, because I think everywhere you go, people talk, and if the correct information isn't out there, then there's nothing to convince people to use this. So it's a really big issue. I think a lot of social marketing organizations who are working in different countries have had a lot of success in this way, that they sort of, in branding different contraceptives, make them more popular. And they do a lot of work, of course, in the communities. So I think they have a very good success rate. but it certainly remains a big challenge. But I guess the part that we're working on is in the studies we have where there are men and women who would like to be using contraceptives, but for one reason or another can't access it. We're at least trying to do our part to make sure that the product is there if they want to use it. There's, of course, many reasons that people don't use contraceptives, but for the part of it that has to do with not being able to access the supplies or to afford the supplies, we're trying to do our part.
Great. Thank you, Karina. Dr. Kirchan, can you hear me? Are you on the audio portion? I see that you're on. I don't know when exactly you got on. Dr. Kirchan is from the Uganda Protestant Medical Bureau. Are you there? I'm wondering if he's there. I was going to see if he could share anything with us, but I'm not sure if he's... I see him on as a web attendee, but I'm not sure if he's on the audio portion. Maybe he's not. Are there other questions? We want to take advantage of this time while we have our colleagues from UNFPA. I'm very grateful that you've given all this contact information for follow-up, too. I think sometimes people have, have questions that come up later, so I'm grateful that you're willing to entertain any questions or comments.
Yeah, absolutely.
Hey, Amy, can you hear me? This is Lauren from IRH.
I'm just now seeing your question.
Great. I just wanted to do a quick response to Katie's concerns in Nigeria. This is definitely something that we've encountered in a lot of our programs globally. And just to say that I work for the Institute for Reproductive Health at Georgetown University, and we have done a lot of the research behind what is called the standard days method and used with cycle beads. And we've really found that that is a great method that addresses many women's concerns about side effects for hormonal methods, and making that available as yet another option in places all around the world so that women can access this has proven to bring new users to family planning, and these women often do transition to other modern methods if their fertility preferences or reproductive health needs should warrant that.
Great, and
thanks, Lauren. It's also available in the catalog now, brand new the UNFPA catalog.
Yeah, I was just going to say that, so that's great. That is the thing that we've also found is that many people who start with the cycle bead go on to use other methods as well. So it's really a good way to get people interested in thinking about contraception for those who have concerns.
I was just thinking there's such a wide array of people that are on this call and some people that I guess couldn't make it. It would be interesting just if everyone is interested, just you can let me know just to share contact information so that people can get connected, people that might not otherwise know about each other to get connected. Lauren getting back in touch with Kadi about what's going on in Nigeria. So if that's, I'll send a follow-up email just to get your permission to share everyone's the contact information. I think that would be really helpful to be able to do that. There's a lot of new names that I saw on the list, and it would be good to find out more about what people are doing and how we could work together in this arena.
Yeah, that sounds great.
Okay, let me see if there's any other questions on the chat. There's someone speaking in the background.
We're also creating a newsletter for AccessRH where we'll updates about new products that we've added to the catalog and things like that. So it will be great if we could also, if you're interested, sign up for that newsletter.
Okay, great.
Yeah. The other thing I wanted to mention is if you have a look at the RH interchange and ever need, there's some information you need or a report that you'd like to do, a graph, and you're having trouble with it, you can always get in touch with us and we can help to put it together for you. We do that a lot of times, so don't hesitate to get in touch with us if we can be of help.
Oh, wow, thank you. That's really nice of you. I've tried to navigate it, but I don't have specific because I'm not working directly in that. It's a little bit harder for me. I don't, it's just kind of theoretical, but it looks like a great tool that it would be helpful to get some help if needed. So thanks for that.
Yeah.
All right. Any other questions before we wrap up? We wanted to make it an hour, so we have a few more minutes, but if there are any more questions, then we can just conclude. All right. It sounds like maybe not. Thank you, everyone, for participating, and I hope you'll join us another time. I was talking to our colleagues at UNFPA, and we thought maybe there would be a follow-up opportunity to have another webinar based on the feedback on this one, and if there's more specific things that people would like a webinar on. So if you have ideas for that, something that you would like UNFPA to dig deeper into, we can see if that would be possible, asking Karina and Ida and others there. So send me your ideas about that if you have some ideas related to this and how they can be of help.
Yeah.
So
and thanks to everyone for giving us the time to talk with you.
And I will be posting this on our website, and I'll just let you all know when it's up on our website and where it is, so you can go back and listen to it again if you would like.
Okay, thank you.
All right, thank you.
Thanks.